Hello again, everyone. My name is Marty Guthmiller. I am CEO at Orange City Area Health System, bringing you today the 45th edition of our COVID-19 community briefing. It's been a whole week since our last briefing. My records indicate last Monday, August 3rd. So we have a few things to get updated on. First of all, it's Monday, and so we have a local scoreboard to report. We've had 13 additional positives here at the Orange City Area Health Systems in the last week. So we had 89 positives of the 1,418 tests that we've conducted. We currently have 6 tests pending. Our positive rate is 6.27%. That is an important number, and it is up a little bit from 5.9%. So a little bit up, but not a bad number. So 89 positives, 1,418 tests. Moving up the chain a little bit to Sioux County, we've had 635 positives of the 4,313 tested, according to the coronavirus.iowa.gov website. And that is a 14.7% positive rate. Still in the 14s, which is a good number, but it is up from 14.6. So slightly up to 14.7 in Sioux County. Stepping up then to the northwest counties in Iowa, the 20 northwest counties, otherwise known as Region 3. There are 23 hospitalized COVID-19 patients in Region 3 as of this morning. That number last week was 25, so a little bit of a drop there. We have 4 people in the ICU in those 20 counties. That was 5 the last time we talked, and there's only been 1 patient admitted in the last 24 hours. So all in all, Region 3 looks pretty good. The indicators are in the right direction anyway. Going then at the state level, the state of Iowa has 49,000 even positives as of this morning of the 523,928 tested. So Iowa's tested over 500,000 people now. The positive rate remains at 9.4%. Very, very constant in terms of that percentage over the course of months now. And so 9.4%. Hospitalizations is the next metric that I use. Again, and part of it is to determine the acuity of the disease. How sick are people actually getting? I think it's pretty hard to manipulate the hospitalization number because you can't fake being hospitalized. And so I think it's a pretty good indication. Hospitalizations as of this morning in the state of Iowa were 201. That is down from 206, so slightly down, last week, Monday. Closer to home, Sioux County hospitalizations are 2, Plymouth County 3, O'Brien County 1, Lyon County 1, Osceola and Clay County 0. Dickinson County 2, BV has bounced back up a little bit to 3. They were at 0. And Woodbury County has dropped to 4, where a week ago they were at 11. Polk County in Des Moines remains relatively constant. They are at 40 patients as of this morning. That number last week when we spoke was 38. So hospitalizations slightly better, kind of holding serve for this week, but in our immediate area, better than other places across the state. Deaths, we're going to talk a little bit again about deaths. We've had 53 more deaths since last week, Monday, and that number is 931. Sioux County has 3 deaths, O'Brien County 2, Plymouth County 9, Lyon County 2, Woodbury County 52. And so I just give you a little bit of a flavor for around our area, more than what we would like, obviously, but that's where it is today. In looking at the statistics of those deaths, really nothing has changed in terms of the basic demographic. Continue to be about 2/3 of those deaths have pre-existing conditions. 88% of those deaths are in the age category 61 or higher, and 0% of those deaths are in ages less than 18. So again, just wanted to throw those numbers out at you. This is still a very serious thing, but again, it is not changing or morphing into something other than what it's been. So it's still people with comorbid conditions. People elderly are still very much the population that we need to be concerned most about. I do want to mention also that there is a new statistic that I may occasionally reference. I may reference it every time, but it's kind of a good one and gives a little bit more of a short-term indication of where things might be trending, and that is percent positive in the 14-day average. So it's going to look over the last 2 weeks and say, well, what's that average been? What's the percent positive over that 2-week period of time? And for some of you that are aware of this, 14 days is kind of the period of time where, you know, if you've been positive and you're clear for 14 days, then you're good to go. So 14 days is a big deal. There's a statistic now that's percent positive over that 14-day. That'll be a moving average. Sioux County's number today was 12%. That is a higher number than we would like it to be. In fact, it is tied for 13th in the state of 99 counties. So this is not one of those where you want to be in the top few percent. We're 13 out of 99. We'd like to be lower than that. Plymouth County, as an example, is 9%. O'Brien County is 7%, and Lyon County is 13%. And so we'll give those numbers, and that's a little bit of a snapshot of the current direction that we're heading. So I like that number. I just can't commit right now that I'll have it available all the time, but we're going to be looking at that number and reporting that to you guys as well. Last week in our organization felt like mile 22 of a marathon that was running south with a south wind in our face and uphill. There were things that it seemed like things were popping up all over the place. That's too broad of a statement, but it felt that way. Things are under control. We've had a few pop-ups here and there. I'd like to give a couple updates on things. We are all growing weary, and I don't mean we in the health system exclusively. I'm saying we as a society are growing weary with all of this. I think we have to be cognizant of that. We have to recognize that, and we have to bear down a little bit more. And if you start using athletic examples a little bit, it's the fourth quarter. Suck it up, get going. So we can do this. We need to stay strong, but we also need to acknowledge that this thing is tough and it is wearing on us all. I want to give you a little bit of an update on senior care. We do have one resident in isolation at Prairie Ridge that tested positive. One, I believe that person is probably coming off of isolation today or maybe tomorrow. And so we will be free then from anybody in Prairie Ridge. And so that's good news. We have not had any new positive activity since we announced those 3 one of which was a false positive, by the way. So want to give that's an encouraging thing for senior care. But we need to run a course of time now before we can advance to the next phase, open things up again. We need to do that absolutely as soon as we possibly can and do so safely. It's very, very important to the health of the residents out there. Want to give a little bit of an update. Testing is going to happen this week for Northwestern College. I don't want to get into the details of that too much, but college is starting. Students are coming in this week. I just wanted to let you know that we are working in conjunction with Northwestern and the governor's office in providing as safe an environment as we can to promote testing there at the college. And just wanted to let you know that that's ongoing and very much part of our effort jointly together. Also want to mention schools opening. And more than ever, we're going to need to exhibit grace in our lives and live grace-filled lives. This next while could be rough in terms of, I'm not saying rough in terms of illness and sickness, that kind of thing, but rough in terms of people's reaction or maybe overreaction to situations that might come up. You can expect positives. I just don't see any way around it. You can expect to see positives. I think the key thing is to know that leadership in our schools, public and private, have well-defined plans. They are prepared to deal with situations that come up. Keep in mind that most kids are asymptomatic. Those that are symptomatic are mild symptoms typically. So we all need to keep this in perspective over the next course of time, whether it's weeks or months, and give each other a break a little bit during this whole process. There are a lot of good people doing a lot of good planning, and we need to utilize common sense. We need to utilize grace, as we've been talking about over the last several months now. Trust the leadership. I'm not saying blind trust at all, but know that there are good people with good plans that are executing them. I think that kind of covers my list for today. Again, I can't emphasize the importance now of mentally being strong, to stay in the race, to know that if we're in mile 22 and it's all uphill, that the grade goes down pretty soon and the running will get a little bit easier. It will. It's inevitable. And so I'm going to stop for today. I will see you later this week if you're interested. We'll continue to do these things as long as they provide value to anyone. Sign off by our normal thing here saying, stay strong, stay vigilant, and most of all, stay healthy. Thank you for joining us.